Some people used to ask, is there any side effect is permanent? Is it going to cause infertility? The answer is no. If you'll see theoretically, this is a medication. So when we take, it gets stored in our body. So once you stop the medication, it will get completely washed away. So it is not possible scientifically to have a side effect even if you have stopped this medication and this medication has been washed away from your body. So it's not going to cause any permanent side effect like in terms of infertility, in terms of decrease in the sperm count. So whatever side effect is described are mostly transient. So it is not again permanent. So side effect can be again divided into two types. One is immediate type, one is late onset type. Immediate type means within 1 or 2 weeks of taking this medication, people start developing these side effects. So this answer is very simple. So in this type of side effects, once you stop the medication, it will go away completely in 3 to 4 weeks. Second, some people used to develop this side effect later. This may be because of cumulative effect, because of the tissue storage of this medication. This type of side effect may take some time to get washed away from your body, but again it is completely reversible. Another frequently asked question is, how long I have to take these medications? If you will see theoretically, the answer is like just because it's a hormone and genetic. So you have to take this medication as long as you want hair. But we have noticed that this aggression of baldness is different in the different age group. Like if you'll see somebody having 20 to 30 years of age, baldness is more aggressive, and post 30 usually the aggression used to decrease in the intensity. So you should continue these medications till your baldness gets stabilized. So what you can do, take this medication at least for 6 months to 1 year, so that you will have a tissue storage, you have a storage effect. After that, whatever effect you have achieved with this medication, you can maintain by taking this dose like alternate day and also maybe twice a week. Then you can give a gap of like 10-15 days or maybe 1 month, then start taking medication like 3 months medication, 1 month gap, again 3 months medication, 1 month gap. By doing so, what are the advantages? One is like you are not exposing your body to higher doses, so that tissue storage will be less. Your body is also getting some drug holiday, and also you are getting less cumulative dose of this medication in your body. And the other way of maintaining this effect is like a topical finasteride. So as of now, oral finasteride is more effective, but topical finasteride may be available in this minoxidil formulation, and certain finasteride gel also available, that you can consider to have a maintenance effect that you have achieved with oral finasteride. But you should consider taking finasteride at least for 6 months to 1 year, then you can maintain by taking the cyclic form or maybe topical finasteride by the gel formulation or with minoxidils. There are certain other DHT inhibitors also available, that the natural DHT inhibitors like saw palmetto, flax seeds. If you see the efficacy, so in terms of prevention of this progression of baldness, if with finasteride it is 90 to 95%, with natural DHT inhibitors is like 40 to 45%. So it has more role in supplementing the effect of oral finasteride, but it cannot completely replace this role of oral finasteride. So the bottom line is, you should consider taking this finasteride to prevent your ongoing process of baldness, to stabilize your baldness, maybe for 6 months to 1 year. After that, maintain it by taking on and off these medications along with these natural DHT inhibitors, maybe with a topical finasteride. Sometimes people used to ask, like initially I had a very good response to the finasteride, but after certain years, like 1 or 2 years, maybe after 3-4 years, I'm noticing that response is not that good, or the response that I have achieved before, it is a plateau response. That means there is no more further progress in terms of regrowth. So this is also a common observation in our day-to-day practice. So in that case, what you can do, there is other DHT inhibitors, is known as a Dutasteride, that blocks both form of this enzyme that is responsible for this conversion of testosterone to DHT. But as it blocks all type of enzymes, the side effect profile is more compared to finasteride. But again, what you can do, you can take it once or twice in a week. It's available as a 0.5 milligram tablets, taken to be once daily. So that you can add like 5 days finasteride, 2 days Dutasteride, so that you are getting more blockage of this enzyme, and in the same time, just because you are taking only 2 times in a week, so side effect profile will be less. That you can think of. So what are the precautions that I have to follow while taking finasteride? So first thing is, if you are planning for a family, you should stop these medications 2 months prior to planning, because though it has been found that the concentration of this medication in the semen is very less, still there is a chance it may affect the fetus. For the safer side, stop these medications 2 months prior to planning. Second thing is, while on this medication, don't do any blood donation. So these are 2 precautions that you have to follow. In that cases, better you can avoid taking this medication, but discuss all these things with your doctor. So what are the indications you should avoid taking this medication? First is, if you are having active liver disease, if for somebody having liver cancer, suppose somebody having erectile dysfunction, then you should avoid taking these medications. So these are all some precautions and some contraindications to these medications. Otherwise, if you will see, in majority of the cases, these are very safe medications. It is a very effective medication to control your balding process. and also to have a regrowth. And as I said, the side effect profile is very less, and second thing is it is completely reversible, and third thing is there are other ways to modify to reduce the effect of side effect by taking in the small dose, by taking in the cyclical form, by taking some drug holidays, taking on and off, or maybe with maintaining with the topical finasteride. So in summary, finasteride is very effective medication in terms of preventing your ongoing process of baldness, and also it is very safe. Side effect profile is very less at 1 mg that we prescribe for this male pattern baldness, and even if somebody develop this side effect, it is completely reversible.